Abdominal cancer treatment in Turkey. People often turn to doctors abroad with cancer problems. After all, there you can count on the best quality and conditions of treatment.
In this video, we'll discuss how Turkish doctors treat cancers of the digestive system organs like the esophagus, stomach, intestines, and pancreas. We will show one of the best oncology clinics and meet with a surgeon who, together with colleagues, treats such diseases.
Subscribe to the channel and ask questions in the comments. Here is everything about medicine in Turkey.
Cancer of the abdominal organs is one of the most common classes of oncological diseases. For example, colorectal cancer ranks 4th in prevalence. Over 600,000 cases are reported worldwide annually. Doctors also frequently encounter tumors of the stomach, esophagus, liver, and other organs.
Many such diseases begin asymptomatically. As long as the tumor does not metastasize to other organs, the person does not experience pain or discomfort.
Doctors advise paying attention to symptoms such as decreased appetite and weight loss, aversion to meat dishes, feeling of heaviness after eating, unexplained weakness, and constant fatigue. Any symptom is a reason to have a thorough examination by oncologists. In Turkey, like in many countries, it's called an oncological checkup. Surgical intervention is considered the most effective treatment for most types of abdominal organ cancers. For example, at the early stage of colon cancer, precursors of the tumor, polyps, can be removed during a colonoscopy. Gentle laparoscopy through small incisions in the abdominal cavity is used to remove large lesions. Our primary focus is on the utilization of contemporary surgical and treatment techniques, and modern is minimally invasive surgery. Professor Ismail Gemceli, a surgeon at one of the foremost oncology hospitals in Turkey, specializes in gastroenterological surgery techniques. Certified specialist in managing the surgical robot Vinci, author of dozens of publications in medical journals and a speaker at scientific forums. Of course, surgical intervention plays a very important role in cancer treatment. Perhaps it is the main part. Because if you can completely cure cancer by surgically removing the tumor, then of course, that is the best outcome. But typically, additional methods are also included in the fight and struggle for the recovery of the patient. This includes both traditional chemotherapy and relatively new methods of radiation and targeted therapy. A frequently asked question is whether we can cure cancer without surgical intervention. Yes, for certain types of cancer, we have patients for whom we have attained highly favorable outcomes without the need for surgery. In certain instances, there are circumstances where surgery is truly not needed or necessary at all and can be avoided. Regarding medications, Turkish oncologists utilize internationally certified modern drugs that have demonstrated their efficacy. Targeted immunotherapy in combination with chemotherapy is used as the first line in the treatment of advanced gastric cancer. Medications such as erlotinib, ramucirumab, sunitinib, bortezomib, and others are in use. They have an impact on cancer cells at the molecular level and enhance their sensitivity to chemotherapy. Depending on the stage of the disease, Turkish doctors can also offer the patient transarterial chemoembolization, radioembolization, laser and radiofrequency hyperthermic ablation, ultrasound thermoablation, and focused radiation treatment with linear gas pedals. During surgeries, the robot Vinci is often used for micromanipulations with precision unattainable for humans. In the advanced stages of the disease with metastasis to the brain, gamma knife is used. Studies show that it is more effective than traditional brain radiation therapy. Surgical intervention in abdominal organ cancer remains the main method used by oncologists. Surgical treatment yields good results. For instance, when removing tumors in the colon, the 5-year recurrence-free survival rate is at least 73%. Of course, experienced doctors should choose the treatment methods. We aim to assist patients who are seeking treatment from us from any country around the globe. However, there are, of course, certain limitations. If patients are in other countries, they must first send us the results of the tests they have already done there, or the diagnoses made by other doctors, before we can proceed with their case. We evaluate them and invite patients to our center if it falls within our scope of work. First and foremost, it is important to understand the problem, because if it turns out that the patient has no chance of treatment, there is no point in traveling from another country. We consistently perform an initial evaluation to prevent individuals from making fruitless trips. However, for an accurate diagnosis, the patient's personal presence is crucial. We need to talk to them about their problem, conduct an examination, and if any tests are missing, perform them at this location. In collaboration with colleagues at our hospital, we evaluate the patient's condition and make decisions regarding the actions we can implement for treatment.
I know that in Turkey, doctors prefer to perform operations on abdominal organs using minimally invasive methods, but can all surgeries be performed this way in your area?
Our initial preference is consistently minimally invasive surgery for all illnesses, particularly for cancer. If feasible, our top preference is minimally invasive surgery for the best possible outcome. However, there are times when this method is not suitable, and in those cases, we perform a different procedure that is more appropriate for his specific situation.
There are always risks of complications during and after surgery, but how big are these risks in your area?
Oncology and complications are akin to a pair of inseparable twin brothers. During surgical procedures, complications occasionally arise. Our aim is to minimize these complications, or perhaps it would be more accurate to say, to provide treatment without any complications. The most crucial aspect is what we have accomplished in our center. When comparing the outcomes from 2 decades ago to the present time, we can state with confidence that complications occur in extremely rare instances nowadays. What is this related to? This is related to the fact that we have the most modern equipment, modern treatment methods, and before performing the operation, we thoroughly prepare patients in all aspects, including nutrition. We monitor the dynamics of their condition, and only after the patient is well prepared, we proceed with the surgery. Immediately after the operation, we try to restore the patient's well-being as quickly as possible so that they can return to their normal life rhythm in the shortest time possible. For each patient, treatment methods are selected taking into account their effectiveness and safety based on the general state of the patient's health, age, genetic characteristics, lifestyle, and other factors. Turkish oncologists utilize international standards in their work, the identical ones that are utilized in prominent clinics in the United States, Israel, Germany, and Switzerland. Not all nations have equally developed medicine, and not all areas can oncology care be equally successful. In recent years, there have been noticeable changes in global stats on medicine effectiveness in different countries, and surprisingly, Turkey has made it onto the list of top medical tourism destinations. Not only due to states' multi-billion-dollar investments in this area, but also to convenient geographical location, good transport accessibility, pleasant climate of country, and very affordable prices for medical services compared to Europe. The quality of training of Turkish doctors is no longer doubted. For more info on the work of Turkish oncologists and cancer treatment in Turkey, visit our channel at this link. To choose a hospital that can truly provide the most appropriate medical care, it is important to know as much as possible about the specifics of different clinics, their capabilities, and how the local healthcare system works. Health does not forgive mistakes. Therefore, the treatment of foreigners in Turkey is handled by a special service company. Her employees know the specifics of this field. They are real doctors with real work experience in hospitals.
After a person submits a treatment request in Turkey, we, the coordinating doctors at Healthy Turkey, select the best clinic and doctors for him based on the diagnosis, preferences, and needs. As practicing doctors in Turkey, we know precisely how to perform it accurately, swiftly, and effectively. Next, we coordinate with the patient the treatment plan and constantly accompany him throughout the trip, as well as stay in touch for any questions even after his return home.
I can't help but ask, how many foreign patients have passed through your hands, doctor? And from which countries?
Our cancer treatment center is situated in a popular tourist area, which leads to a high influx of patients from overseas. I can state that we accept patients from Europe to countries in the northern region and Asia. There is nothing more joyful than knowing that a patient is coming to us from another part of the world because they have confidence in our services. Certainly, the inhabitants of our country trust us, but it is incredibly valuable and immensely pleasant for us that people in another part of the world who have never known us before place their trust in us for their health. I have visited many hospitals in different parts of Europe, and I had the chance to observe and learn from them firsthand. I am able to say that in Turkey, we provide faster, more reliable, and highly responsive medical services to our patients. We utilize the most cutting-edge devices and diagnostic equipment. The equipment that you have witnessed in the biggest centers across the globe is also accessible within our hospital. We employ the most current methods of diagnosis and treatment. A significant portion of our doctors are genuinely experienced and well-trained professionals, physicians who have completed internships in renowned centers abroad. And another major advantage is that, along with these colleagues who are doctors, we are committed to providing the finest contemporary medical care. I believe these are the most significant reasons why international patients select us. Turkey is advantageously distinguished from other countries by a comprehensive approach to patient care. In other countries, you often have to pay separately for each manipulation. The company Healthy Turkey is responsible for organizing visits of medical tourists to Turkey through the all-inclusive system. They work only with verified specialists in both medicine and hospitality and coordinate all their work for each patient. Healthy Turkey takes all responsibilities upon itself, from consultations and agreements with the clinic and doctor to transfer, accommodation, immigration formalities, and translation of medical documents. Contact for consultation at this phone number or through chat on the company's website, address on screen. There is a lot of information on other directions of health tourism. Don't forget to subscribe to our channel and don't miss new videos about medical tourism and assistance to foreign patients in Turkey.